the capital flexion, capital extension. And just to show you what this looks like before I get my hands and I'm start mobilizing him, capital flexion is this, right? That's all it is. Before we don't want to move into the cervical spine. And then extension, capital extension, essentially is him moving his chin out and out. Yeah, there you go. There you go. Just like that. That's good. And then come back down. Yep, just like that. It's that small little movement. So we've got protraction and a little bit of extension, or retraction and a little bit of flexion. That chin tuck position. But we're not really doing anything with the lower cervical spine right now with these two techniques. And so in the first technique, he's trying to move that lady into some capital flexion. And what he wants to do to really try to isolate it to the OA joint and those upper cervical segments, he finds C2 and then he puts his thumb on top of C2 to try to block the flexion and the anterior superior movement of C2 when he guides the head into this position. So kind of like a chin tuck here. Sit up nice and tall for me. I gotta move you down. I'm really gonna get a handle on you. And that's important too. As much as you can get your patient to start in neutral spine posture, the better. Their feet should be on the floor like he is now. Otherwise, he's probably already started like this, because we all sit like this, and if he starts in bad posture, I'm not going to get him flexed back where I want. Okay. And then this is just a supportive hand to try to guide in that motion. Make sure he tucks his chin. So my elbow here is kind of hugging his chin and making his chin tuck down. And it's small. I think that's kind of the questions I heard this morning where I feel like I'm not even moving the head. You shouldn't. All I'm really trying to do is this. And create that chin tuck position. I don't want him to move C2 through 7. So if it doesn't look like your patient is moving very much, you're doing the right thing. So I'm trying to block movement from C2 down with my thumb on top of that spinous process. And then in the next technique on the page, we're doing the opposite. Now our hand position changes, and what they're trying to do is grasp C2 in this position. I told a lot of students this morning, realistically, I don't feel like we're really doing a lot of stopping this segment from moving. We're going around muscles for one. And then, I mean, you just don't get a very good grip on it, but I still think you should attempt to try to block C2. So you're grasping the transverse processes as much as possible. And then basically taking this type of a hand position to do that. And basically get him to move into kind of so he's kind of doing a protraction and extension. So there you go, like that. That's what he's doing. So this part of it, I'm kind of moving him a little bit forward like this and back. Like that, to get that technique. I think it's easier to see without my arm around him, which is why I keep moving it here. If you can get that part of it down first, and even do it on yourself, so you can see how capital nodding and capital extension work, you'll be able to feel it for your patient. It's going to be really minimal. And then imagine that you have a patient, and he's pretty tight. Have a patient that's really tight, and then they hardly move at all, and you're trying to guide that. You shouldn't see a lot of gross movements here, so don't let that throw you off. You're not going to have big movements here when you're going through this